Hello, all my lovely Patreons and Substackers. So this month I am doing something a little bit different for the Sacred Sexuality series. Previously, in I don't know, about 6 to 9 months ago, we did talk about erotic massage, incorporating that into your sex magic practice or your sacred sexuality practices. We've talked about the bioanatomy of psychic sexuality, but today I kind of wanted to focus on special circumstances and how you might want to approach those in your practice. So let me pull up the PowerPoint. It always takes me a hot minute here, folks. Hang on. All right. So this month, I thought we would focus on erotic massage and touch for life changes, specifically menstruation, pregnancy, men and aging, menopause, sensation blockers caused from surgery, illness, drugs, and the sexual effects of drugs. So, in the past, when we have dived into incorporating erotic massage with the bioanatomy system, we never really talked about special circumstances and how you might want to approach those, process those, and handle those just a little bit differently. So I thought this month we would take that opportunity to kind of jump into that. So let's jump into it. All right. So I'm approaching this in a partnership model. A lot of you are solo practitioners. If you are a solo practitioner, definitely take what you can from this presentation. There's a lot of good information in here. But if you have a partner that you practice with, I am kind of approaching this in that partnership model. So when you work together in partnership to overcome difficulties created by life changes, it's a really great opportunity to strengthen the bond of love that kind of underpin your relationship during changes, right? So I think for all of us living like in a very fast moving, sort of urbanized, technologically advanced society, we do tend to lose touch with the natural rhythms of life in general. We have to kind of distance ourselves from those external rhythms. And that's kind of led, I think, a lot of people to ignore the internal rhythms and patterns, particularly those that are related to growing older. Now, I'm going to address a lot of things today, but I think one of the most difficult changes in terms of, practicing sex magic or sacred sexuality is the aging aspect. Um, a lot of times, by the time we reach 50, we are still feeling young inside. We still feel the same way we did when we were 15, but our body obviously doesn't work the same way it used to. And so as we age, unless we've been, really, really, really good with keeping fit, which is hard to do, we're most likely going to be a little bit slower, a little bit stiffer. And, no one ever really expects the aging process to be reflected in their sex life. I think a lot of people think that as you age, that just kind of goes away or dies off, and that's not true at all. I think that the biggest thing that we see happen isn't that the sexual desire dies. It's that a lot of times illnesses, physical problems, those affect our sexual capabilities. And for women, especially, pregnancy, nursing a baby, menstruation, perimenopause, menopause, there's some really big shifts there that can affect our ability to tap into that sexual energy, that raw primal energy to manifest. So I'm going to kind of break it down topic by topic. If I can find my mouse, there it is. Okay. So start with lack of desire. So there are a lot of times I think in our lives, it's going to be normal to feel a lack of sexual desire, when stress is high and we're focused on other things. Maybe we don't want to take part in sex during certain phases of our life. And we don't really need that sexual release. I mean, I've been there, I've gone through that. I know a lot of people who have. There is nothing wrong in feeling those things. There's some good reasons why that may occur. It doesn't necessarily mean that, we're lacking, that want in any way. It's just that life sometimes we have to reprioritize things, but it is kind of like a Greek tragedy a little bit, especially in hindsight, because time, that one currency that we can never make more of, once it's spent, it's gone. And some of us have spent years in celibacy because we put other things above our sexual practices. So, sensual response. The response that we experience doesn't change. It remains steadfast throughout all these periods in our lives where we have these sexual fluctuations. Because touch is comforting, right? Any kind of touch. It doesn't have to always be sexualized. It's sensualized, right? Big difference. We probably need sensual touch more than we need sex, to be quite honest. Our bioanatomy or our psychic sexuality benefits from that sensual touch, whether it's sexually oriented or not. So, we're going to talk a little bit about touch patterns and rights. Those can help us through some of these more tricky stages of life where we're dealing with sexual blockages, we'll call them. I think that the touch patterns we'll talk about today, you should combine them with, very basic everyday loving touch, to keep your relationships on track, that sensual touch. It doesn't always have to be, like I said, eroticized, but a lot of times it will become eroticized. And that's where you kind of tap into your manifestation, your sex magic. But, if your partner is going through a major life change, he or she is liable to feelings of uncertainty and insecurity, of course. And you're going to need to show a great deal of sympathy and understanding during those times. And you should always combine that with just good old fashioned tender loving care, right? Um, and then there's, of course, menstruation, between the ages of roughly 13 and 50, and that varies wildly. I know I started menstruating when I was 9. Everybody's different. It's a genetic thing. I know women who have menstruated until their late 60s. Okay. So it's different for everybody, but this is kind of like the rough age frame. Between these ages, most of us are going to have that monthly menstrual cycle. And there's a lot of physical manifestations that occur during that period of ovulation and shedding of the lining of the uterus, and it's usually our hormone levels that are going to fluctuate, and our moods are affected by our hormones. So during these periods of time, women tend to experience emotions on a cyclical basis, and so definitely that is when erotic massage, sensual touch is going to be very beneficial for that individual. I have so many pictures on here. I don't want to like cover them with the Zoom screen. Okay. So I think the best way to discover what your monthly emotional pattern consists of is to keep a diary, a journal. I talk about this all the time, the importance of keeping a journal and, just tracking all sorts of things for manifestation purposes. Also for focus, for goal orientation, goal acquisition. But this is a good thing to track as well, because you're not just charting the starting and stopping dates, but you're charting the physical changes that you notice, the emotional changes that you notice, kind of noting which day in the cycle they occur so that you can plan ahead. Again, awareness is preparedness. I'm always saying that. This is going to show you how your moods alter during your menstrual cycle. And then you're going to be able to predict how you're going to be feeling. And if necessary, maybe alter behavior to compensate for maybe a rough day or two. Menstruation and touch, the hormonal fluctuations of menstruation can affect how we experience touch. Menstrual symptoms, hormonal changes in the second half of the menstrual cycle can cause a lot of adverse effects, things like headaches, tender breasts. I think during those periods, your partner just cuddling with you, bringing in that relaxing warmth. We've talked about that before in erotic massage and in bioanatomy of psychic sexuality. Relaxing warmth is, just a beautiful thing. When you're kind of tapping into these energies or you're trying to restore, repair these energies. So, your partner can cuddle you in a spoon's position, right? That's considered a relaxing warmth exercise. I also noted on here, there have been a lot of studies, especially in Europe, not so much in the United States, but they tend to all kind of be on the same wavelength here that women usually feel at their most sensual right before menstruation. So a lot of times when I have clients who are kind of tracking their sexual magic practice, that week before menstruation, they are very, very active sexually. That is when their hormones are peaked. That is when their manifestation through sex magic is peaked. So just kind of keep that in mind. That week before menstruation is kind of like a sweet week for most of us that practice sex magic. All right, so building on sensitivity. Okay, so relaxation. And I have a picture of a pregnant woman here because I'm getting ahead of myself. Pregnancy is next. But relaxation, by increasing tension, you can eventually relax, right? So a lot of times what we'll recommend is like going for a long swim, a jog, something that uses up all that spare energy. It's going to help you if you don't really enjoy physical exercise. It's a good alternative to put yourself through those tension and relaxation meditation exercises. But relaxation is key. In any sacred sexual practice, you have to be relaxed. So you need to be relaxed enough to build on that sensitivity. So exercise to burn off spare energy. If you don't like exercise or you can't exercise due to physical limitations, do tension and relaxation meditation exercises. I have a whole video on those. I think I posted it maybe back in oh, probably 6 or 7 months ago. I'm not really sure when, but we do have, I know on YouTube, a video full of these meditation techniques. So check out our YouTube. Physical warmth. So again, what we were just talking about on the previous screen, the previous slide, many women, not all, of course, find, having that physical warmth helps them to relax. So if you have that loving partner, ask them to snuggle with you. The spoons position is what I recommend. Now, if you don't have a partner, maybe a hot water bottle is an acceptable substitute, but try to enact physical warmth as a relaxation technique to build on sensitivity. And then, of course, the tried and true back massage, right? So, a back rub in which your partner squeezes the pressure away from the base of your spine is really invaluable. There is that golden rule, of course, is giving feedback, right? It's important that we communicate and give feedback to each other when we're using sexualized or sensualized touch. Telling them what feels good and what doesn't feel good. Maybe you prefer a light touch when, a firm touch feels uncomfortable. These are things that have to be vocalized. Don't expect your partner to be psychic, right? We talk about psychic sexuality, but don't expect them to just know. Ask them to try a light fingertip touch that might just float over your skin and kind of transform that tension into eroticism. If your discomfort is like metamorphosized in this way, lovemaking, orgasms, those are going to be very therapeutic for you. But sometimes, again, I threw this line in here that even light touch can be irritating depending on where an individual is at with their hormones or with their, life in general. So again, communication. But if you're wanting to relax into eroticism, I believe that those very light fingertip touches, we've talked about this in previous Zooms, that where they float right over the top of the skin, it is very transformative for tension and turning it into eroticized sensual touch. So keep that in mind or give it a try. All right, so let's talk about pregnancy just a little bit. So pregnancy, obviously is a time of major change for both, both individuals, the expecting couple. So, above pretty much everything else in their life is kind of, I don't want to say thrown to the sidelines, but definitely deprioritized when you have a baby on the way, and as the woman kind of grows larger, her bump gets larger, a lot of times her partner starts viewing her as a mother, right? And this can sometimes be difficult to deal with because it's kind of like a weird area, right? Mother slash lover, those two some don't go real well together mentally. So I think one of the most important practical moves that a man and his partner can make at that time is literally staying in touch. When we talk about erotic massage, I think, pregnant couples really benefit probably the most because loving touch reinforces the bonds between them to both their mutual benefit. So it's doubly important to the pregnant woman too. Let's not, sugarcoat that. Massage during pregnancy is an excellent addition to everyday touching, cuddling, and kissing, right? You got to keep doing those things every day. So it is a means of maintaining those loving bonds between you. And most of the strokes used in ordinary massage is also going to work well for a pregnant woman, but some of them are especially pleasing, right? Because they're going to be a little bit more sensitive to those touches. Again, back massage, by massaging her lower back, you can help to relieve the strain caused by the extra load she's carrying. And when we talk about massage strokes in erotic massage, the base of the spine for a pregnant woman becomes kind of desperate for relief, right? It's carrying an extra load. And an alternative that you can use to ordinary back massage is to have the woman sit or kneel while her partner rubs her lower back very gently. It's firm, but it's gentle with the palm of his hand, right? Instead of the fingers. We're not going to dig. A woman's legs also take the extra weight of the baby, right? And by the end of the pregnancy, they're probably kind of full of fluid a little bit, right? I had that happen. That was horrible with Madison, my first one. Cramping is common. I used to have Charlie horses from hell when I was pregnant with Lainey. And I was taking prenatals and doing all the right things. But the point is that classic draining strokes, for the legs are ideal here. We've talked about that in the past. Um, I always reference that as kind of like the waterfall position in yoga. I love legs on the wall. That's one of my favorite positions. And I used to have lymphatic drainage issues. I don't anymore. But, having her put her legs up against the wall and massaging those downward strokes very gently. That's going to be very, very helpful. And it's going to feel really nice. So let's see what else I put here. I can't see because this damn box. All right. So I would say waterfall position, we talked about that. The classic circling stroke can be used on all areas of the body. And those fingertip strokes that we've talked about, that brush kind of the pregnant abdomen very, very gently is going to stimulate the nerves on the surface of the skin and alleviate strain for her as well. Now, you can use those fingertip circling strokes during labor. So stroking that abdomen can actually reduce the sensation of the contractions for some women. So that's going to be very, very helpful for your partner if you can help reduce or minimize the pain of that. So after the birth, physical and emotional problems definitely can make this a time when it is easy for the couple to feel really alienated from each other, So anything that you guys can do to build a bridge between you is going to be of great value. So touch serves as a great bridge. And massage, is a large part of the supporting structure of that bridge. So the touch needs to be one way during this time. Honestly, I'm not trying to jip you guys, but it's a one-way thing. It's in her direction. And she can repay you later with some, sexual treats once her desire returns. But, to kind of ease her tired muscles and help her to relax, give her a soothing back massage and, finish off with those neck strokes, forehead circling, temple presses. We've talked about this previously as well. The forehead circling, you're going to use the pads of your fingers. You're not going to be using like fingertips, but you're going to make just tiny circular strokes all over the forehead, working from one side to the other and back again, varying the pressure and varying the speed of those strokes. Now, temple presses are just that, placing the palms of your hand on each side of the forehead, holding your hands lightly, right? And then press gently, and then you're going to let go, and then you're going to do it again. I know it doesn't sound like much, but this is like a beautiful way to relieve pressure and tension in that area. So, let me move my box again. Again, with massage and pregnancy, when massaging a pregnant woman, always ask for feedback to find out which spots to focus on, which to avoid. Of course, you want to avoid putting any kind of weight on or around the bump. The mother should be really lying down in such a way that the bump feels very comfortable and supported. Ordinary back massage strokes aren't going to work if, she's not in that comfortable position, and it's hard to find. You might need a few minutes to figure that out. All right, so moving forward, let's talk about men. So, a decline in a man's, sexual powers as he grows older is really kind of a different life change to the others that we're going to be discussing tonight, like menopause, because for men, it's a very gradual process. It's not like a single identifiable event. So every man kind of experiences it a little bit differently. But there are some common denominators, right? Emotionally and physically that many men are going to share. A man who's 50 years old is probably going to need twice the penile touching and rubbing to stay erect and achieve orgasm versus a man in his 30s, right? He's going to find that loss of hardness can be a problem, as is loss of ejaculatory power and sensation. So, an older man may need a lot of attention from a very loving, and skillful partner before he can even get an erection. And you may also find like one orgasm a day is going to be his limit, maybe even less. You know, I think sex can be compared to like riding a bike, right? In good health, we can do it at any age. But you may take longer to arrive and you may have to pedal harder when you're older. But the journey is, perhaps more pleasant if you don't rush it. And the older lover can be a very satisfying one. We know now that 60 to 70%, and this is an actual figure, of impotence cases have a physical cause. The majority of these are curable, so a man who is dealing with impotence now, he should go ahead and get some medical advice so he can get the right medication. There's so much on the market, which is nice. That hasn't always been the case. I gotta move me again, you guys. I gotta move these damn boxes. How do I get rid of these boxes on Zoom? I mean, somebody's got to let me know. Anyway, hormonal changes, men deal with these too. So there's no hormonal menopause for men like there is for women, but there is that, gradual decline in, levels of the male sex hormone testosterone that's circulating around in the bloodstream. So men reach their peak at about 18, and their ability to be sexual, to feel desire, and to experience satisfying erections, orgasms, that's all on the decline after. So that kind of sucks if you think about it. Um, it's very gradual. Most middle-aged men are very capable of powerful sexuality and wonderful orgasms under the right circumstances. But there are those, that would probably agree that it does take longer to reach orgasm and that they kind of need that firmer, direct stimulation. So aside from declining testosterone, there are other aspects of aging that can really affect sexual performance at this age. That failure to achieve or maintain an erection. Um, it could be a number of things, you guys. Some of the examples I used was like late onset non-insulin dependent diabetes, prostate surgery, the after effects of that. Those are instances of physical conditions that really impede the ability to have intercourse. And most men see their sexuality as an integral part of their personality. And so they worry about symptoms of aging, probably more so than we do, right? Because it just affects their whole ego structure differently. All right, so a little help. If easy erections are vital to a man's confidence, there's so many drugs on the market. I use Viagra as an example, but there's so many now. These things work wonders. Um, there is something to be said about fearlessness, right? Opening your mind to making new moves to improve lovemaking. For many older couples, lovemaking can actually improve thanks to experience and wisdom. So there's that, right? Increasing his response. So obviously there's some, I gotta move this box again. This box, I don't understand. It's really starting to piss me off, you guys. I do not know how to get rid of it. If anybody here knows Zoom, please let me know how to get rid of this black box. All right. Increasing his response. So oral sex, genital massage, and masturbation with a firm hand. Those are good starting points, right? Asking for feedback. We've talked about that in previous months when we've talked about eroticizing touch. How might you increase the feeling? Could your strokes be rougher, harder? What about other aspects of increasing his arousal, right? Using an element of fantasy might be helpful. There's anal rimming. That's a big thing. Seriously. That's kind of where you run your fingertip around just outside the rim of his anus. That can be extremely arousing for a man, but you got to get creative sometimes, especially as aging kind of takes its toll. So, an aging man's long term partner may recognize that lovemaking isn't what it used to be and may encourage him to seek out maybe some medical intervention. Um, the pattern of a decline in a man's love life, sometimes it seems like it's written in stone, right? So it takes a huge shift in mindset to realize that sexual patterns can and should be altered. They're not meant to stay the same. Um, you're still capable of learning new lovemaking techniques even after being 20, spending 25 years with the same person, the same routine, right? You can always change things up, just like any other elements of life. If you're going into a new partnership, men usually are anxious. They feel a lot of pressure and sometimes consider it a burden to explain that he's not able to be as spontaneous as a younger man. So these are all things to be mindful of. These are all things that are things that you can kind of navigate, just by that mindfulness. Most women, however, are, usually very tolerant of these kind of differences. And they're often going to see new sexual needs as a challenge, like an exciting one. I don't think the right partner is going to mind too much about any kind of needing to incorporate sexual aids or any kind of special attention if, he needs it. She's going to be more than willing to do anything she can to help his fulfillment. And if she isn't, you're with the wrong partner. You need to find a new partner. So let's talk about menopause. So all women go through this. Not all women do experience a midlife crisis, though. I mean, I've had several, so kudos to those of you that somehow bypass it. This can be a very difficult stage in a woman's life. It's like just when these physical changes, like in your body, are making you feel older or more tired or less attractive. Not to mention, more anxious, maybe a little bit more depressed. You have your kids leaving home, and sometimes, at this midlife stage, a lot of marriages fail and there's a lot of divorces that occur between, early 40s to mid 50s. So a lot of women do feel kind of totally unwanted as a result of going through menopause, which is awful, right? There are the women that feel healthier, more balanced emotionally than they have, in years. And they do go on to tackle careers or new studies, kind of like with a renewed vigor. But I feel like that is the minority. I think many couples, they enjoy life together without the constant demands of a family, because your kids are leaving home and they kind of rediscover each other too at that point, so it's not all doom and gloom. Um, but as a result of these physical changes that occur, it does make sex kind of less satisfactory because there are lower levels of the hormone estrogen in a menopausal woman. So that can lead to like a lessening of the vaginal lubrication. Um, so intercourse, of course, is going to become uncomfortable. Stimulation of the genitals don't work as effectively as they did before. Usually, postmenopausal women need longer and more careful, stimulation before they can, reach climax. And a lot of times there needs to be a little bit of help there. So, there are things like HRT, hormone replacement therapies, or lubricants. You don't have to necessarily take, a replacement therapy, but it may be necessary, or you may want to play around with different lubricants to try to kind of overcome this little bit of a hurdle that pops up during this process of change. So, two of the big areas here, libido and depression associated with menopause, you know, there is that lack of desire that kind of comes into play after menopause. Obviously, one theory is that as those estrogen levels wane, lovemaking usually halts around this time or right after it. And so too do the levels of testosterone. So we have that testosterone as well, just not as much as men. But testosterone is the hormone that is believed to be responsible for libido. So, many menopausal women are treated with extra testosterone to try to increase their sex drive, with the advantage of also experiencing increased energy and strength. So, you kind of have multiple benefits here from taking that supplement. Um, Anyways, during this major life change, women do need partners to be especially understanding. And if your partner isn't, you need to find a new one. I'm sorry, especially if you're in your 50s or older. Um, so it can be hard not to take the volatility as a woman, right? I think it's advisable that we should each personally look for other motives. That's always the sensible approach because we are a little bit more volatile and reactive during this change because of these fluctuating hormones, especially if we're not supplementing with an HRT or with testosterone. So, one of the underlying characteristics of menopause can be mild depression. And sometimes it's so mild that many women are kind of unaware of it, to be honest with you. It's not always in your face like the movies. But remember, depression, it accentuates emotions, it amplifies them. Um, so, acts of kindness are going to have greater meaning too during this time. So the counterpart here, her partner, any kind of, treats or special somethings is going to be more meaningful. So that treat of a little neck massage, or just simply like kind of arranging to do something nice or something pleasurable for her, that alone becomes a loving act of really great significance for somebody who is working through menopause. So for her pleasure, I put um, as part of kind of eroticizing sensual touch here, give her an all over body massage, performed simply but sensitively, ask if there are any spots of tension or pain and try to stroke them away, right? Very simple. Then you should probably try to extend the massage to her genitals, right? And use a vaginal lubricant, right? Not massage oil. Um, Use those gentle, genital massage strokes. There's actually a video we put up. Again, it was probably about 6 to 9 months ago when we were going over the sexualized chakra system that actually has diagrams of these strokes. Again, it's on our YouTube. Check it out. But you're going to use those to pull up her sexual response, right? You're going to reapply lubricants. You're going to kind of let her feel bathed in it as your fingers explore her labia and then her clitoris. Especially important is establishing a rhythm. Making it clear that you're going to keep this up for a long time, right? Verbalizing that. So it may take a menopausal woman longer to climax, but when she does, it's likely to be very powerful because of that extended buildup. You can also use aids like vibrators, but of course, ensure there's plenty of lubrication, right? Because in menopause, that's needed. All right. So giving reassurance, right? So a sense of warmth and closeness is an invaluable gift, to give to a menopausal partner, and it's going to calm and reassure her. Um, so yeah, so let's talk about sensation blockers. I think I beat that bush to death tonight. That sounds kind of like funny, but I didn't mean it literally. All right, don't beat the bush to death. All right, sensation blockers, right? Both men and women are likely to experience a loss of sexual desire and performance at some point in their lives or multiple points. And, this is going to be caused by a number of factors. I kind of lightly glazed over this at the beginning of the presentation. So, some instigators, of course, are going to be things like depression, right? That's common in both sexes, to each gender. There are some that are more specific to each gender. So, let's talk about depression first, right? So, depression really inhibits sexual desire of males and females. And especially when we're talking about manic depression, when it's in its manic state, this can actually have an opposite effect. And that's why I'm bringing it up because it kind of exaggerates sexuality. It tends to lead to things like promiscuity, drugs, and the need for psychotherapy, right? And the drugs that are used to treat things like, schizophrenia, for example, they affect sexuality. The condition itself does not, but the treatment does. So it's important that we kind of talk about this because I think a lot of sensation blockers are due to prescribed medications, especially for mental health reasons. These mental health drugs, which I'm going to go into a little bit tonight, they all seem to have the same side effect of just kind of killing the sex drive, the sex hormones. Um, Antidepressant drugs, especially, they do have mixed effects on sensuality. Um, they may bring back desire and sensual sensation after they've been dampened down by depression, but they also tend to impair the mechanics of orgasm. So you get your desire back, but you can't get to the finish line. That's almost like a cruel twist, right? So it's usually only by coming off antidepressants that a person can get his or her like desire, arousal, and performance fully back to normal again. So if you are somebody who is taking, antidepressants, I'll go through some of them tonight in the presentation. Understand that if you're having issues in this arena, it is probably related to the medication you're taking. And if you are a sacred sexuality practitioner, if you incorporate sex magic into your practice, this can be a very big deal because it's going to affect your ability to manifest through those means. So it's important that we talk about it. So providing support, if your partner is experiencing problems, let them know that you understand and listen sympathetically if they want to talk about it. They need that. You need to be receptive to that. It can be uncomfortable, but we just need to do it. There's really no ifs, ands, or buts. So let's break it down between men and women. When we talk about females and sensation blockers, there really hasn't been enough research in this area as far as I'm concerned. When I was researching it, I was really kind of shocked. at how lacking some of the documentation is, especially that around hormonal causes. But, a lot of researchers do agree that it's hormonal imbalances that cause a majority of these sexual difficulties or these sensation blocking difficulties. I think, from what I gathered from my research is, estrogen in the right balance is responsible for a woman's sense of well-being, right? If it dwindles, it's not just that the skin's becoming less elastic, but intimate touch, which was previously very pleasurable, is now irritating or even painful. The vagina is among the areas affected, and it may lose enough moisture and elasticity to make intercourse difficult without lubrication. And it makes it even harder to achieve orgasm. And then testosterone, which women possess in much smaller amounts, like I said earlier, than men, that provides the ability to experience sexual sensation and desire. So if this dwindles, right, women do lose interest in sex and they're not going to be eager to be touched, and they find it hard to climax. So another problem is, from what I researched, the high levels of the hormone prolactin. So this hormone prolactin is secreted during breastfeeding. It can sometimes persist after nursing too, you guys. So high amounts of prolactin are responsible for things like weight gain, fatigue, and loss of interest in sex. So I think if you experience persistent loss of sexual sensation, you really do need to talk to your doctor and you should get a hormone level test, across the board, your estrogen, your testosterone, is there prolactin in your system? You just really need to have a good panel done, and talk it through. You're right. If a medical or emotional problem is impairing your enjoyment of sex, you just discuss it honestly with your partner. Don't, it's not a deep, dark secret. It's something that needs to be talked about. They're supposed to be your support system. So, if you're having these issues, have them support you. So let's talk about illness. Illness obviously is another area that kind of blocks our ability to manifest through sex magic or to have a consistent sacred sexuality practice. When we get sick, actually, I think for most of us, we can't manifest much at all because we're sick, right? Physical illness affects our ability to manifest, I think, across the board. But when we're talking about sexual practices in sacred realms, most of the illnesses that affect male sexual sensation are also going to affect women, but there are some that women are more prone to. So, older women who have not been on hormone replacement therapy are going to find that their joints ache. Later on, they may be suffering from osteoporosis or brittle bones or that Dowager's hump. That's that stoop caused by the crumbling of the top of the spine. If you've ever seen somebody kind of bent like this, my grandma had that. I didn't know what it was called. I just thought it was from her always kind of bending over things. So that's one result of that condition. Pain, arthritic hips, that's much more common in women with osteoporosis, pain in the joints. These are going to make things like lovemaking very difficult, right? Now, there are ways to kind of get in front of this. If a woman begins HRT, say in her mid to late 40s, that's going to act as a preventative to osteoporosis, right? So I do think older women do benefit from starting HRT because it can restore bone density to some extent, not fully, but to some extent. And it also gives, some protection from heart attack. So it's kind of like an added benefit. But just as male sexual activity is made possible by a healthy blood supply to the penis, female sexual activity is very similarly facilitated, right? You have blood flow that needs to get where it needs to go down there. So, there is unfortunately limited research into this, but, I think it's pretty reasonable here to assume that obstructions to the blood supply in the area that affects male erection is equally likely to impair female sexual response if that's an issue. And that could be caused by arterial disease. That could be responsible for it. So might scar tissue. Studies of diabetic women, those have shown them to be free of sexual problems, providing only that their diabetes is well controlled. If it's not controlled, there's issues. They are more prone, though, when I was doing this research, I found out to vaginal infections like yeast infections. And of course, if you're having problems like that due to illness, diabetes, of course, sexual interactions of any sort or infections of any sort are going to disrupt a good sexual experience. And these things happen and they just require prompt treatment is basically how you need to approach it. Um, and surgery, that's another one. So, anesthesia and the shock of surgery itself on the body can cause, short-term post-surgical depression, and that lowers desire for sex. Talking can help, but in a lot of cases, this kind of depression usually lifts spontaneously anyway at some point. However, there are radical surgeries like vasectomies, stoma surgeries, those can bring in a more extreme form of depression, right? So we use loving touch, eroticized, sensualized touch to restore good spirits and good sensation during these periods of recovery. Hysterectomies, or the major hysterectomies where we're removing not just the uterus, but the fallopian tubes, the ovaries, what is that, ovariohysterectomy, they call it, when all that's being taken out, you know, that's really extreme regardless of age. I have a friend that's gone through that process, and you experience the effects of menopause immediately after, and it's usually accompanied by all those classic signs, including that vaginal dryness. So HRT and estrogen cream for the vagina can be a great help here. You probably would benefit from like a spiritual counselor or advisor to like a therapist of some sort, because it is traumatic, right? It's very traumatic. Other things that occur are surgery tears during childbirth, right? And the subsequent repairs and surgeries affecting the rectum, that can all inhibit your perineal blood supply. So that's going to reduce sexual response, right? Poor stitching after childbirth can make intercourse painful. Now, that can be remedied, of course, by surgery, of course, to cut out that scar tissue. Funny story though, my grandma, when she gave birth to my mom, her doctor was drunk and sewed up her asshole. I'm not kidding. This is a true story. She ended up going back to the hospital after she was sent home and had to have it fixed, had to have that opened up and then, everything fixed. But you wouldn't believe some of the shit that's happened. Like back in the day, it was like the Wild West. I mean, obviously, there's a lot of safeguards in place now. This doesn't happen very often, but back in the day, like this happened a lot more than you realize, like where they were stitching up shit wrong. Isn't that crazy? It's wild. Anyway, male sensation blockers. My grandma's probably turning in her grave right now laughing because I brought up that story. Anyway, male sensation blockers. So, there is this concept referred to as body armor. A lot of times if you're researching this, you'll see the term body armor. And so what this is, the theory is that some people, specifically men, are permanently tense. I mean, there are women that suffer from this too, but they haven't been studied as much as men have in this area. And this tension is expressed by kind of unconsciously holding the muscles taut. Have you ever met somebody, they're just so tight all the time, right? They're just like all the time. So the overall effect is that this tense person is wearing like a layer of muscular armor to kind of protect themselves from the intrusions of the outside world, right? So a man like this is probably going to get very little out of overall body contact, right? And would instead probably just be focusing all of his sensuality on just his penis. It's the one organ allowed to be vulnerable, right? So there are techniques for individuals like this called Rolfing. And the spelling is here on the screen for you. But this is a form of very deep massage. It's different than deep tissue. It can be very painful to receive. And, usually when Rolfing is offered, it's combined with some sort of like talk therapy, right? Because there's usually underlying trauma or something there that needs to be healed, or fragmentation, soul retrieval work. So as the tension decreases, in the person receiving treatment, you know, they start usually talking about what's contributed to this building up of such a huge barrier. So I think rolfing is excellent in these situations, whether it's a man or a woman, but I don't think it's a technique that can be done by an amateur. I think that this is one that is best left to professionals. I think, soul retrieval, fragmentation, clearage, those types of techniques, fine, but rolfing, because there is some pain and it needs to be done a very specific way to kind of release what needs to be released, that people go to college for years to learn how to roll appropriately. So I would look for somebody who specializes in that if you need it, or if your partner needs it, or a friend or a family member. Um, okay, so we're getting into the fun part here, drugs. Look at this, all these drugs. I love when I do Google or image searches for these things. I always find such interesting things. All right. Physical sensation blockers. So disease, of course, diseases that affect the nerves, MS, um, diseases like this reduce tactile sensation. So localized conditions also affect sexual response to you guys. So nerve damage, like after prostate operations, can cause an inability to achieve erections. Other causes and dysfunctions are like painful arthritis, anxiety as a result of asthma. A lot of people who have asthma have this secondary anxiety disorder because of it. So, all of this results in this unconscious kind of blocking of sexual signals from the brain to the genitals. Okay, so surgery, obviously, that can create mild depression, which may in turn result in that lessened sexual desire for a while. Some men, they suggest that surgery can impair their sexual feeling and may cause a loss of feeling for a short time. So, one of the biggest things, you guys, when we're dealing with physical sensation blockers, if it is coming from an emotional, mental, spiritual place, is that positive attitude. Just like in manifesting, when we're manifesting a goal that we're trying to work towards, it's that positive mindset, positive affirmations, guided imagery, yoga nidra, visualizations, journaling, all these different techniques that put out that positive energy and that positive orientation. So a positive attitude is going to reduce the risk of these things kind of morphing into huge problems. Um, so mindset is everything. It really is. It controls so much. Diabetes, again, if you're diabetic, this is at some point probably going to affect things like erection, but not desire, which really sucks, right? It's like an evil kind of twist the universe put on you there. But there is injection therapies that can provide for artificial erections for people that are dealing with this. So check into that. If you are a sex magic practitioner, if you have a sacred sexuality practice, you got to get creative sometimes, right? So, reassuring touch, again, warmth. We talked about this a couple times today. Use warm moves like stroking and squeezing to reassure your partner. So, let's talk about drugs real quick. So, other causes of male sensation blockers, could be adverse reactions to certain drugs. This affects women too, but men seem to be 80% of this market when these drugs that we're about to talk about. So a lot of drugs commonly used in the prevention and cure of illness do and can impair sexual performance, as can alcohol, as can illicit recreational drugs like cocaine. Alcohol is a brain depressant. In small amounts, it kind of reduces anxiety and inhibition, and this can allow people to be more, sexual and have sexy feelings and, kind of to emerge. And, maybe that wouldn't be possible if they didn't have that little bit of alcohol. However, in large doses, alcohol rapidly impairs physical and mental functions, including sexual response in both men and women. So it reduces testosterone levels, okay? And many men find it difficult to get an erection when they are drunk, right? So barbiturates and other hypnotic drugs have a very similar action point here. So let's jump into it. There's a few that I did a couple screens on that I thought we would just kind of discuss tonight just as reference points. But the sexual effects of drugs are kind of a serious deal, especially since today there's a drug for everything. You go to the doctor, you have a headache, he wants to give you 3 new drugs, right? So, a lot of medicine prescribed for very common medical problems do have these unwanted sexual side effects. And as a practitioner in this craft, it is going to throw a monkey wrench in your manifestation rights if you're having to deal with this kind of stuff. So, some medicines may not possess any unpleasant side effects on their own, but those side effects appear if those drugs are combined with other drugs, other medicines, or with alcohol, for example. So it's vital that you kind of check all your drug usage interactions before interacting them. If you can't talk to your doctor, talk to your pharmacist, use Google, use something, right? Knowledge is power, awareness is preparedness. So alcohol, we talked a little bit about alcohol. Small amounts can increase desire by reducing anxiety and kind of loosening inhibitions. Moderate amounts can impair a man's ability to achieve or sustain an erection and may even prevent him from ejaculating. And chronic alcohol abuse can make a man impotent. And that's been shown to happen time and time again in studies. Then there's steroids, anabolic steroids, such as nandrolone. I think that's how you pronounce it. But misuse of these drugs can cause a lot of different sexual problems. Some are very, very serious. This includes a drop in the amount of testosterone circulating in the blood, leading to decreased sexual desire. It's shrinkage of the testicles, impaired sperm production, the growth of breasts. So now we're having mental, emotional, spiritual problems. Women tend to grow facial and body hair, right? And develop male pattern baldness. And of course, they're going to experience menstrual and ovulation problems, enlargement of the clitoris. Steroid misuse can also trigger rapid mood swings, increased aggressiveness, paranoia, even psychosis. Antidepressants, we touched on this a little bit already. Tricyclics, amitriptyline. You guys, I'm going to start tripping on my tongue. I am. SSRIs, serotonin reuptake inhibitors, like fluoxetine. I put MAIOs on here, right? Like phenelzine. Antidepressants may cause a loss of libido and inability to achieve orgasm in both men and women. In men, we see this failure to achieve an erection as well. The longer you're on it, the more these side effects become obvious. They start affecting you in greater ways. What do I got, like cocaine or heroin here, huh? I do have cocaine on the list. Not, I don't think I have heroin. Maybe I do. I think I did put heroin on here. Just I'm trying to be comprehensive. Blood pressure meds, right? So blood pressure control drugs they're called antihypertensives. They're beta blockers, right? So like propanol. Here we go. Or alpha blockers like dexasen. I know I'm not pronouncing it right. So antihypertensives can cause erection problems in men. So be aware of that. The longer you're on these drugs, the longer, the more aware you're going to be of these issues. Cannabis. Now, I have all sorts of videos on my channels where you can incorporate cannabis into almost every element of an omnistic polytheistic practice, right? Um, with cannabis, sexual effects of small amounts are really subjective and really kind of difficult to quantify. But I think one of the main effects of this drug appears, to kind of be the enhancement of the user state of mind. So, if you're feeling tired, it's going to send you to sleep. If you're feeling sexy, it can make you feel more so, right? The effects of heavy long-term use are a little bit more serious, but usually disappear almost immediately when consumption ceases. And, the effects could include a drop in the amount of the sex hormone testosterone circulating in the blood, leading, of course, to decreased sexual desire. It can lead to impotence and impaired sperm production in men. So, in women, we have seen like impaired ovarian function after real heavy long-term use. You're not going to experience these things if it's once or twice a week. These are daily users for years where, it's a lot. Cocaine, small amounts actually increase sexual desire and enable men to actually delay orgasm. But again, heavy prolonged use is going to lead to sexual dysfunction in men and women. In men, you're going to see it, come about as impotence, and in women, they're going to have what we call orgasmic failure. They're not going to be able to get there. Diuretics, so there's lots of diuretics on the market. I don't even know which this one is. I use as an example bendroflumethiazide. I don't know. I was doing research late, you guys. So sexual problems, can affect a small percentage of people taking these drugs. Desire could be reduced, and some men do develop erection problems. Potassium sparing diuretics like spironolactone, those drugs can cause a decrease in sexual desire and erection problems for men. Then we have H2 receptor antagonists. These are in ulcer healing preparations. So examples would be cimetidine and ranitidine. These drugs can, on occasion, cause erection problems in men too. And again, I just wanted to give you guys some examples of, the things that are being prescribed that can throw a monkey wrench into your sacred sexuality practices. So hormonal preparations, just kind of as an extension here. Androgens, these are testosterone preparations. Those drugs do help to restore sex drive and orgasmic ability in both men and women. Anti-androgens, such as cyproterone, exultate, those reduce sexual desire. They may occur in both men and women. Men may also experience erection problems. Estrogens, these hormones improve vaginal lubrication in postmenopausal women, but in men, they may cause loss of sexual desire and erection problems. Oral contraceptives, birth control, you guys, old school birth control. These effects really are variable. Some women say that they find sexual desire decreases, others say that it increases. I think there is a mental aspect here. I think if you're on birth control, you might be more comfortable, a little bit, feeling more safe to go out there and have sex. So, because these drugs ensure that intercourse doesn't lead to pregnancy, you might be enjoying sex a lot more, right? You're not worrying about that thing. Okay, so narcotics, hydrochloride, heroin, methadone, Vicitone. Am I saying that right? Vicetone. I'm not sure what that is. But when I was researching it, it kept coming up. Short-term use can lead to decreased sexual desire and, of course, addiction, right? So in men, often, this is going to lead to impotence, ejaculation problems, and eventually sterility. Now, female addicts, again, just like with cocaine, they lose the ability to orgasm. Isn't that horrible? Like to just like not ever be able to orgasm again. Can you imagine? That's horrible. I mean, that's almost like a fate worse than death. Anyway, did I say death or death? You know what I meant. All right, sleeping preparations, you guys. So nitrazepam, right? Some sleeping drugs are associated with changes in libido, so be aware of that. You can have that lack of desire with sleeping meds if you're using them almost every night. If you're using them occasionally, I don't think you're going to have issues. Tranquilizers, right? Benzodiazepines, lorazepam, diazepam, all the PAMs. Those, I put a whole bunch of other ones here too for you. Use of these can lead to loss of libido. Phenothiazines, such as chlorpromazine, hydrochloride, these cause erection problems in men. So again, you shouldn't be in a situation where you're taking tranquilizers very often, but if you are, understand that over time, these are the side effects and how they'll affect your sexual practice. So, all right, let's see what else I got. Nothing. Look, it's the thank you screen. So yeah, so I went in a little bit of a different direction tonight. Let me close this out. I'll stop my share. I just thought, we spend all this time month after month talking about practice points, but we rarely go over, what could be throwing a monkey wrench in, what to be aware of, what to look out for, and how to kind of navigate that, especially with things like erotic touch, erotic massage, sensualizing touch, which is so important if you are in a sexual magic practice or a sacred sexual practice with a partner or with a group of individuals. If you're solo, obviously you can navigate things, but it can become very complex and becomes very important in the context of having to deal with monkey wrenches when other people are involved. So I thought we would do this tonight. It's something different. I thought it was some really good information to put out there. And of course, as always, stay magical. And I shall see you next month in I think next month for our Sacred Sexuality series. I might be going into another form of erotic divination. Last month, I did vulvamancy along with panty readings, bed sheet readings, and I think I'm going to roll something interesting along those terms out again next month. We'll see. I haven't decided yet, but you guys stay magical and I'll see you soon.